Hello everybody, welcome back to my channel. My name is Saima. Today we are going to talk about implementation station in the Osce. So as you know, it's the medicine administration station and it takes 15 minutes, but we always run out of time. So better we need to prepare, practice, so we can do it in time. Let's start the video. Before we start the video, I want you to go through the implementation marking grid. First of all, as you know, we do the pre-procedure check. We check the patient privacy, patient safety, all the ID checks. So pre-procedure things are done, introduction has been done, and now we'll start with the reviewing medications. So the first thing you need to remember is ensure patient ID information is correct on all the pages of the prescription. Review prescribed drug by reading out loud, and also to check the validity and eligibility of the prescription. Then before you decide to give any medication, please check allergy status and start medication and PRN medications. Check the patient vital signs if you need to know the heart rate if you're giving digoxin, oxygen saturation for oxygen therapy, and also that indicate reason and how this finding influence drug administration. If PRN medications are prescribed, confirm with patient if they need it. Immediately code the drugs if you're not going to give it, and then you verbalize whatever you're doing. Then you prepare the medication, drug preparation and administration. Remember always to check if patient has any questions before you give them medication. Maintain hand hygiene throughout the procedure, and also check the condition of the trolley, whether it was locked when you open it, and then you're going to keep it locked. Select the required medication, check integrity and expiry including batch number, write 7 rights of the medication, write drug dose, time, administration route, documentation, and whether it's valid and legible. All right, and then as I said, you need to check the condition of the trolley, take the medication and the prescription chart of the patient, check the IDs again. Three things: full name, date of birth, address, hospital number on the ID badge, and also allergies. Now we have checked all the things before you give. Make sure patient is sitting upright, and then if they are able to swallow the medication. And also they're not going to take the medication without the water, so offer them some water before you give them any medications. Also at the end, you need to record the dose and sign the prescription chart, and what did it say? Record the dose given and sign the prescription chart, and in any other place made necessary by the legal requirements of hospital policy. And at the end of the procedure, just check if patient is comfortable, safety is acknowledged, site rails are up. These are the things you need to check in your implementation station. So let's start the procedure. Let's start the implementation technique itself. So this is the implementation overview sheet which you're going to get in the exam. You have 15 minutes to complete this section, and before you start the exam, before you start this station, they'll give you a few minutes to read the first bit, but not the medication things. All right, so let's read what it says. Write the candidate name first of all, and then it says note to the candidate. Talk to the person. First point, please verbalize what you're doing and why. Read out the chart and explain what you're checking, giving, not giving, and why. Complete all the required drug administration check. Complete the documentation and use the correct codes. The correct codes are on the chart and on the trolley. Check and complete the last page of the chart. You have 15 minutes to complete this section, including the required documentation. Please proceed to the administer and document her XXX medication in a safe and professional manner. So what they're checking, whether you're a safe nurse, whether you can give medication within the time frame and according to the prescription. Now let's assume that we're giving the medication at 12 o'clock today. Let's start it. So the first thing we're gonna see is that we need to make sure the patient name is correct on all the pages. So it says Rachel Smith on the first page, date is today's date, hospital number is there, date of birth is there, and address, also the ward. So let's see on the second page, says Rachel Smith, today's date of birth, and hospital number 0043281. Yeah, it seems the same, Rachel Smith, but make sure you check on all the pages. Yep, everything is correct, so we can start. The second thing we have is allergies and sensitivities. Patient is allergic to penicillin and the type of reaction they get is anaphylaxis. Date is today and the doctor's signature, consultant signature is there, Dr. Campus. And now information of the prescriber, for prescriber. So use capital letters, sign and date, including lip number, sign and date, allergies box. If no allergies, they need to write no known allergies, record details of the allergies, and different doses of the same medication must be prescribed on the separate lines. Cancel by putting line across the prescription and sign and date. Indicate start and finish date. So these are the things which are for the doctors, for the prescriber, but we need to make sure that all the things are complete before we give any medications, right? Like it says, if they cross the medication, they should have a line on top of the thing which they are canceling. There should be a line and then they need to sign and date. And also if there is no start date and finish date on a medication, you cannot give that medication. Make sure you remember this bit. Now the second thing is for us, for nurses, information for nurses administering medication. Record time, date and sign when medication is administered. Use the following codes if a medication is not administered. Number 1, patient not on ward. If patient is not on ward, you want to give that medication, so you are not going to write patient not on ward, just write the code number 1. Number 2, omitted for a clinical reason. Number 3, medication is not available. Number 4, patient refused medication. Let's say if you're giving Movicol laxatives and patient says I don't want that medication, then you can write patient refused the medication, number 4. Number 5, nausea, vomiting. Number 6, illegible prescription or wrongly prescribed medication. Number 7, nil by mouth. Number 8, no IV access. And number 9, other reasons. Please document. So if you're doing number 9, you need to document the reason why you did not give. So same thing, it says if medication are not administered, please document on the last page of the drug chart. So let's continue reading. Does the patient have any documented allergies? Yes or no? If it's yes, it's highlighted, it's in bold, so yes. If no, should be no. Please check the chart before administering a medication. Here it says again which ward, surgical one, consultant is this, and then any special dietary requirement, yes or no. Weight 5 feet, height is 5 feet, weight is 65 kgs, and says that any special requirement, dietary requirement, it says gluten free. We need to make sure that we don't give them anything containing gluten. Now the first point in the prescription is says only once only and stat doses. These are the medications we give only one time as stat doses. So first thing it says today at 7:50 we gave prednisolone 40 milligram per oral. It was prescribed by this doctor and who gave this and then who checked what time it was given. The second thing is at same time ipratropium bromide 500 micrograms, it was nebulized, and then who prescribed, why it was prescribed. So how you gonna rate it? You're gonna read, so I did not mention how you're going to read the implementation. In the beginning of the implementation station, you are going to read the prescription throughout the whole prescription. So it will take you like 2 minutes maybe. So make sure you practice it. You practice it reading. So you can say this prescription is for Rachel Smith. Her date of birth is 12/1/42. Hospital number is this. Address is this. She has allergic to she's allergic to penicillin, and then she gets anaphylaxis. Doctor is Dr. Campus and date is today. So her height is this, her weight is this. She has special requirement, dietary, gluten-free diet. I'm gonna start with the once only and stat doses. Today's date is today. Time was 7:50. Drug name is prednisolone. Dose was 40 milligram. Route is per oral. Prescribed by Dr. AJ1234. Given by RN Beth Louie and checked by RNY. Time given was 7:50. The second the second drug today was given at 7:50. Also ipratropium bromide 500 micrograms through NEBS. Dr. AJ was the prescriber, and then Beth gave at 7:50. So this is the way you're gonna read it. You're gonna read all the prescription like that. Next point. So we have checked in the beginning that name, date of birth and all the things are correct. The next point we have is prescribed oxygen therapy. Date is today, time is 7:50. Prescriber signature is there, and targeted oxygen is more than 94%. Therapy instruction for oxygen, if oxygen falls below 94, then nasal specs 2 liters we need to give oxygen. There are no signatures of the doctor, there are no time started, and the signature they did not write it, so this is not the valid prescription. I believe prescriber signature and believe is there. Time start, oh no, I'm sorry. So date is there, time is there, prescriber signature and belief number is there. So this is the time when you started. When you give the oxygen, then you're gonna write it here, and then if you give it 10 minutes, then you're gonna time it. Yeah, this is the oxygen prescription if the oxygen falls below 94%. The next thing we have is PRN medication. PRN medication today, paracetamol 1 gram, dose was 1 gram per oral for pain. Dr. AJ 1 2 3 4 was the blip, and given by SN. Time given was 6 o'clock. So we need to keep in mind that 1 dose of paracetamol 1 gram was given today at 6 o'clock. And then the second dose, the second PRN drug is, date is today, drug is codeine 30 milligrams per oral, 6 hourly for pain, and prescriber is the same one. Let's go ahead. So now we know that PRN paracetamol was given, codeine was not given, but we have a prescription for codeine if patient asks for the pain relief. Antimicrobial. The drug is flucloxacillin, date is today, dose is 500 milligram, frequency is TDS, route is per oral, duration is for 5 days, and the timing is 6, 12, and 18. Now, start date is today, finish date is plus 4 days, prescriber signature and belief number is there. Is this a valid prescription? Pause the video, look for all the things, let me know. Okay, so I suppose so. This is the valid and legible prescription. We have dose, we have drug name, we have dose, frequency, route, duration, timing, start date, finish date, doctor signature and belief number. So this is a valid and legible prescription. But talk to yourself, ask yourself, are you gonna give flucloxacillin? Does the patient have any allergic to flucloxacillin? Do we remember patient is allergic to penicillin? Patient is allergic to penicillin. Are we gonna give We're not gonna give flucloxacillin. Yeah. So we are still reading. Going through the prescription, but you can make a note in your mind that I am not going to give flucloxacillin. Why I'm not gonna give? You can read the codes again. If you don't remember, read them again. Omitted for a clinical reason. You can write here. We are going to do it for 12 o'clock, right? Just write 2. Omitted for a clinical reason. The next thing we're going to read is drug is digoxin, date is today, and the dose is 1.25 milligram TDS. Route is per oral, duration is 5 days, 6, 12, and 1800 hours. Start date is today, finish days plus 4 days. Dr. AJ 1 2 3 4 5. 1 2 3 4. Sorry. Is this a valid and legible prescription? So whatever prescription you read, you need to make sure that it's a valid and legible prescription before you decide whether to give it or not. What do you think? We have all the points there. We have right drug, dose, frequency, route, duration, timing, start date, finish date, doctor signature. So I think it's a valid and legible prescription. Patient is not allergic, she's only allergic to penicillin. So we can go ahead and give this medication. So we are keeping in mind that we're going to give this, and this, yeah. So I know the first drug I'm not gonna give. The second one I'm gonna give digoxin. Yeah, if you want to open the trolley and then pour out the medicine, you can take it out, no worries. But if you want to read all the drug chart first in the beginning, take your 2 minutes, read all the drug chart, and then go to your trolley and prepare the medication. I would prefer to read the drug chart, the full drug chart in the beginning at first, and then when I'm reading all of the things, all the prescription, then I will go to the trolley and take the medication out. So I'll pause here. I will not prepare any medications at the moment. Now the third one is drug. There's nothing, so we can go ahead. Now we have checked in the beginning, everything is correct, date of birth, name, everything is correct. Regular medication, it says regular medication. Drug number 1 is paracetamol. Date is today, dose is 1 gram, frequency is QDS, route is per oral, duration is 5 days, 6, 12, 18 and 2200 hours. Start date is today, finish date is plus 4 days, and doctor signature and bleep number is there. Am I happy with this prescription? Is this valid and legible? Yep. All right, but do you remember that it was given in the PRN medication, wasn't it? Paracetamol was given today at 6 o'clock. So it was given at 6. So prescription says 6, 12 and 18. I can still give, isn't it? I can give. So keep a note in your mind that you're going to give paracetamol. Okay, next point, regular medication. Ipratropium bromide. That's the inhaler, isn't it? Date is today, dose is 250 micrograms, TDS. And then nebulization, time is 8 o'clock, 12 and 18. And then start days. Oh, where is that start date? Where is the finish date? Doctor signature. So I am not going to give. I'm not happy with this prescription. There is no start date, there is no finish date, there is no signature of the doctor. So am I going to give? Of course not. So we need to check which code I am going to put. Eligible or incomplete prescription, we're gonna write 6. If you want to code right away, it's fine, do it. Okay, the next thing in the regular medication we have is drug is ferrous sulfate. Date is today, dose is 200 milligram OD, frequency, route, I cannot see route, duration is 5 days, time is now, start date is today, finish date of plus 4 days, doctor signature and bleep number is there. Is this a valid prescription, guys? Come on, let me know in the comment section. Is this a valid prescription? No, because we don't have a route here. We don't have route, so we're gonna write 6 as well. We just check that if a prescription is not valid, we're gonna write 6. Now, last but not least, intravenous fluid therapy. So if they prescribe any fluids, date is today, fluid is 0.9% saline, 500 mils, rate is 4 hours. In 4 hours, prescriber signature Dr. HA1234, batch number is there, commenced at today 7:50, RN batch checked by this lady, and then it was finished at 11:50. Do we have any more prescription? No. So this is done. Now on the last part it says drug not administered. If we did not give any medication, why we did not give? Date, time, drug, reason, name and signature. So whatever we coded, we're gonna write it here. Date is today, time is 12, drug is flucloxacillin, reason, patient is allergic to penicillin, your name, and then signature. So first thing that we coded is there, we have documented it. The second thing, paracetamol, we are going to give ipratropium bromide. It's a 6, so 12, 4, 2022 at 12 o'clock. Ipratropium bromide, prescription not legible, or complete. You need to write your name, signature, everything there. The third thing, we had something, isn't it? It was ferrous sulfate, because root was not there. Ferrous sulfate. Prescription not valid and legible. Then you sign. So our coding is complete now. Now once again, go through the drug chart. She is allergic to penicillin. I'm not gonna give flucloxacillin. Yeah, once only and start dose. Prednisolone was given, and then ipratropium bromide was given. Oh, it was given as start, but anyways, we are not gonna give. We coded it because it was not complete prescription, isn't it? Yeah, so we are not worried about this. We are not worried about ipratropium. It was given in start dose, prednisolone, ipratropium bromide. So we're not worried because this prescription on the second page in the regular medication was not complete. So it's fine. Then we have oxygen. We don't need the oxygen therapy. At this point, patient has the prescription for oxygen therapy. While you reading the prescription, just ask the assessor, assessor, is the oxygen saturation of my patient fine? Is this normal? If the assessor says, yeah, oxygen is fine, you don't need to administer oxygen at this point. If they say the oxygen saturation is below 94, then you're going to administer oxygen at this point. Yeah, you're going to administer as well. Here we need the prescription for oxygen therapy, so you cannot just give oxygen without the prescription. Okay, so we will see again that paracetamol was given as start dose, flucloxacillin we hold it, so we're not worried about it. Now digoxin. Now I have read all my drug chart. I'll go to the trolley. I will make sure that trolley was locked, and I'm the one opening it. I opened the trolley, I took the pod, I took the digoxin. Now here, digoxin. Nobody reminded me that digoxin is for the heart rate, right? So we need to check whether the heart rate of the patient is all right, whether it's within therapeutic limits. So just ask the assessor while you reading that, assessor, I'm gonna give digoxin. Is heart rate of my patient okay? And then the assessor says, yeah, it's fine, you can go ahead and give. When they say the heart rate is fine, it's above 60 and under 100, just give it. If the heart rate is high or above 100, you can still give digoxin. You cannot give if the patient is bradycardic. Yeah, so these are the things. For oxygen, you need to ask the assessor. For digoxin also, you need to ask the assessor. And then in the regular medication, we had paracetamol. So digoxin we are happy to dispense. Yeah, dispense the digoxin. Check the dose again. Check. So now I'm holding digoxin in my hand. Check the medicine name, check the dose, 1.25 milligram we're giving, and then route is per oral, start date, everything is correct. My prescription is valid and legible. I am happy to dispense this medication, and I have dispensed it. Yeah. Now the next one, paracetamol was given at 6, but they did not sign here because maybe they signed it here, but they could have signed it here as well, isn't it? But they signed it in PRN, so it's fine. So 12 o'clock, now I'm giving paracetamol. She is due as well. She is in regular medication, so we can give paracetamol. Happy to dispense. Check the right drug, right dose, right time. Everything is correct, right signature, and documentation is complete. Yeah, dispense the medication, guys. Next, ipratropium bromide. We say we're not going to give. We code it as 6. Illegible prescription, not legible. Finish date, start date is not there. Doctor signature is not there. Ferrous sulfate. So, we said we're not going to give. So, don't worry. Fluid we're not going to give. We have documented everything. So, now I have my pod. In my pod, I have digoxin. I have paracetamol. And then that's it, digoxin and paracetamol. So now I go back to my patient. I've taken the medicine. I will lock the trolley, take the pod with me, go to the patient and ask, are you all right to take your medication? Yeah. And then again, you're going to check the patient ID. You're going to check name, date of birth, hospital number, your ID checks on your prescription and the patient ID band. and the patient can verbalize. Yeah, you need to ask the patient that all the things are correct. Since we have checked all the checks, make sure patient is sitting upright. Ask the patient, are you able to swallow the medications? And it says yeah. They say yeah, I can swallow the medication. Give them the medication, and then ask patient allergy also at that time again before you give the medication. Since you're giving paracetamol and digoxin only, tell the patient, I'm not your antibiotic flucloxacillin, I'm not giving because you are allergic to it. Iron tablet, I'm not giving because I still need to ask the doctor, they did not sign it, or whatever the reason may be. Just verbalize to the patient. Yeah, and then when the patient says yeah, I'm all right, I'm okay to swallow the tablet, give them the tablet, give them some water, and then when they have swallowed, stay with the patient. Ask the patient, have you swallowed your tablets? And they say yes, I have swallowed. Okay, now are you okay to sit for some time, or you want to lie down back? And then whatever their preference is, just make sure before you leave the patient is comfortable and okay to sit or lie down, whatever they want. And then you tell them, I have given your medications for 12 o'clock, and then I'll be back after some time to check on you. Yeah, you given paracetamol, just check if they are in pain, if they need anything else after some time. Yeah, and then now you have done your medication. Now you need to sign. Don't forget to sign. Never ever forget to sign. They say if you didn't document it, you did not do it. So oxygen we didn't give, paracetamol was given as PRN, this one we coded, digoxin we signed already, regular medication paracetamol signed, not given, and then we coded everything. So am I missing anything? Yes. The first thing, Mr. Osce. First thing you need to remember, write the candidate name. Never forget the candidate name. First of all, write the candidate name. We have written the candidate name. All my signatures are there. Everything is there. Yeah, I have 1 minute. I will just go through it again. Yeah. I have given the medication properly. I have completed my time. Now I have documented. So I'll tell the assessor, you can stop the watch. I have done my implementation station. And then they'll say, do you want to go through it again? If you're happy to stop it, close the they can close the clock for you. Yeah. All right, so this was our implementation station. Hope it helped. I tried my best. I made it for you guys just to give you an overview. One more thing I want to say it here. Paracetamol, sometimes it says cocodamol. I said in my previous video also, is codeine and paracetamol. Don't forget. Yeah, so if it says cocodamol was given at 6 o'clock, so in this timing it was still all right to give paracetamol at this time. Yeah, but if it was a different time, then you can always check what time PRN was given, and then whether we are giving it on right time or the right medication. Yeah. All right, guys, so I'm done for today. I hope I helped you with this video with implementation station. This takes too much time, guys, so just an overview. Read the prescription. When you start, read the prescription all the way till the end. Read the prescription, everything, and then go to your trolley and prepare your medication. Okay, so I'm a little bit breathless because I never talk for this long. I'm so sorry, guys. I'm still recovering from COVID, that's why. Please remember me in your prayers. Thank you so much for watching. Hope you all guys pass your Osce in first sitting. Take care. Have a good day. Thank you for watching.